This is an introductory video for Midlands and Lancashire Commissioning Support Units Demand and Capacity System. I'm Anthony and my details are below, so should you have any questions after viewing this video, please do feel free to contact me. The system was originally designed to facilitate operational management within the Shropshire local health economy, following extensive stakeholder engagement from acute operational managers and directors, senior clinicians, commissioning managers, improvement team specialists and social care colleagues. However, since its inception, the system has evolved to include facility for primary care clinicians and other clinically trained colleagues to assist in individual patient management. Modules have also been created following that input to show historical activity and forecasting with regards to urgent care demand. The system is capable of receiving data from multiple sources at predefined intervals. The majority of our feeds are received every 15 minutes. This is an agreed happy medium. For all intents and purposes, it's considered real-time. However, being pseudo-real-time means it doesn't place unnecessary and excessive burden on provider organisations' IT systems. The system is capable of receiving data via several methods. Secure web service, which is our preferred option, but it can also receive data via secure file transfer protocol, web scrapes of published websites, or via predefined email. In order to provide a little context regarding the current layout, the Shropshire Local Health Economy has a single acute trust operating across 2 sites. As you can see, Princess Royal Hospital, PRH, occupies the left-hand side of the screen, and the Royal Shrewsbury Hospital occupies the right-hand side. Starting from the top, you can see that the Princess Royal is currently running at escalation level 2, and the Royal Shrewsbury Hospital is running at escalation level 3. The West Midlands has a team called the Regional Capacity Management Team, who operate a system called the Escalation Management System, or EMS for short. The escalation levels have been defined across the West Midlands, and in the case of acute trusts, they're based on 14 triggers. An algorithm is used to calculate the escalation level based upon the responses of the provider sites in regards to those 14 triggers. The dashboard receives this information via email, which are received roughly 3 times per day. As you can see, Princess Royal, as I said, is running at escalation level 2, and that's based on the response that the clinical site manager, in this case Rob Garbett, has inputted with regards to these 14 triggers. Following on from the escalation level, the dashboard progresses to mimic patient flow as it affects emergency care. So, arrival via ambulance, time spent in ED, ward admissions and discharges, delayed discharges, and ward occupancy levels or bed capacity. The dashboard receives information from West Midlands Ambulance Service via an established web scrape every 15 minutes that details all patient conveyances and associated turnaround times. As you can see at the Princess Royal, they currently have 1 active conveyance and a mean turnaround time of 8 minutes. That 1 conveyance is en route, and there are no active conveyances at RSH. The next logical step is regards to the emergency department. As you can see, there are 9 patients currently waiting at Princess Royal, none of whom have been waiting more than 4 hours. RSH, they've got 17 in the department, and 13 have been waiting more than 4 hours. Since midnight, you can see by how long patients have been waiting, how many patients have entered the department, which is this column, and this column talks about patients that are currently still in the department. So as you can see, there's been no patients breached 4 hours. 1 patient has been in the department 3 to 4 hours, and they're currently still there, and that's this patient. So they arrived at 8 minutes past 5 this morning. They had a DTA time of 35 minutes past 6, which stands for decision to admit time, and they've been in the department 3 hours and 41 minutes. that patient is obviously going to be admitted because of the DTA time. As you can see further down, the number of patients that have been in the department less than 4 hours, so that's all of them, and the average time in the department for current patients is 55 minutes. The average time in department for patients that have been in since midnight is 1 hour. You can see here normal activity for a Friday is the red line, and the blue bars are the number of patients that have come into the department. So it's kind of following trend at the moment. Conversion rates, so that's the number of patients that have arrived and ultimately been admitted onto a ward. Time from arrival to decision to admit, so 2 hours 39 minutes is the time there. If it goes over 2 hours, then it starts to get a little bit, you can see that it's busy in the department. They're having issues getting people down to make that decision to admit the patient, or they're having problems with the actual number of patients in the department. Where time from DTA to admission is in the red or the amber, you know actually they've got issues with finding beds for the patient, which isn't an issue at PRH, but as you can see at RSH it's quite a bad issue, so that they're over 4 hours. Inpatient flow, so this talks about the number of admissions versus the number of discharges. So they've had 18 patients more discharged than admitted. So positive numbers are a good story. If it's negative, you've had more admissions than discharges, which obviously has a negative impact on the bed base. The green bars here indicate the number of discharges, and the red bars are the number of admissions. The blue spots that connect them are the difference between admissions and discharges. So if the blue spot is in the red sector, you've had more admissions than discharges, which has a negative effect on the bed base. You can easily spot where the weekends are. They have poor discharge performance, and they have less admissions as well, but generally the blue spots tend to be in the red sector. Here is just a tabular format of that information. So that was 28 days, and this is the previous 24 hours, number of admissions versus discharges, and the variance between. These are the short stay units. So you've got the acute medical unit, and over at RSH, acute medical unit, surgical assessment unit, and clinical decision unit. If they're green, that means that they can accommodate patients of either gender. If they're amber, it means that they've got space for a patient of a specific gender, so they can only accommodate male patients, or they can only accommodate female patients. If they're red, they're completely full, they can't take any more patients. Waiting for action. So these are the patients that are medically fit to be discharged. By clicking in here, you can see the most common reason for patients to still be in wards despite being medically fit is awaiting further non-acute NHS care. Sorry, it doesn't quite fit on the screen here, it's because of the resolution I'm using. So the longest waiting delay is a patient who's been on the stroke ward at Princess Royal. They've been there for 45 days, but they've been medically fit for 21 of those 45 days, and it's because they're awaiting nursing care home placement. There's free text here that's been inputted, and that'll give discharge liaison nurses and social services colleagues information as to why that patient is still in the hospital. Finally, bed occupancy. So this talks about for every single ward that they're grouped into a ward grouping. So you've got your acute adult inpatient wards, which are your normal bread and butter wards. Assessment wards, so that's SAUs, MAUs, CDUs. High dependency wards, so that's your cardiac care unit, ITU, HDU, and other not elsewhere classified, so that would be like your day surgery wards, etc. By clicking the blue arrow, you can see it individual ward basis as well. So you can see how many occupied beds by males, females, and NGS, which stands for non-gender specific, so that would be things like side rooms. You can also see how many vacant beds there are for each ward, how many patients definitely going home today, potentially going home today, and potentially going home tomorrow. You can also see a length of stay profile for that ward grouping. So that's the dashboard proper. As I mentioned at the beginning of the video, there's been other developments with regards to forecasting historical information and information for primary care colleagues. So that was the dashboard. There's also GP activity. So for each individual practice, when a user registers, they'll say that they belong to a practice, if that's the case. As an example, I've been associated to 2 surgeries in Shropshire. Looking at this, you can see for Mitten Oak practice, one of their patients is currently in A&E. By clicking on that, if I was a clinician, I'd be able to see their NHS number, but I'm not, so that's hashed out. And you can see that this is an 89-year-old male who arrived in the department at 6:10 this morning via an ambulance. As well as seeing A&E attendances, you can also see patients that have been admitted. So currently 20 patients from this practice have been admitted, and 5 from Doddington surgery. And you can see here, again, you'd see the NHS number if you're a clinician. As a validation check, again, you've got gender and age. So this top patient is a 72-year-old female who was admitted on the 1st of October for a non-elective. They've had a length of stay of 1 day, and they're on the ambulatory care unit at RSH. By clicking the eye, you'd see a little bit more information, so the name of the consultant that they're under, what specialty, and whether allied health professionals or social services are required. Where a patient's medically fit to be discharged, you'd also have information here regarding why they were still in hospital despite being medically fit for discharge. The dashboard also has information with regards to forecasting. So by clicking here, you can see how many A&E attendees we're predicting are going to be coming in based on the past 6 weeks' worth of activity. How many are going to be admitted, fit for transfer numbers, and admissions and discharges. You can also see the actual demand. So for Princess Royal, this is the number of patients that arrived on the Wednesday. The little square here is indicative of the escalation level. So green for escalation level 1. I'm not sure if there are any greens. Yeah. Yellow for escalation level 2. Orange for escalation level 3. And it'd go red if they were escalation level 4. And you can see some key indicators for each of those days. It can also be broken down by time, so if I click here, it'll break the day up into chunks of 8 hours. And finally, fit for transfer delays. So these are patients that are medically fit to be discharged, and you can look back historically to see, for a given time frame, for a specific site. So if I select RSH, you can see all the patients that have been medically fit for discharge by number, and they're grouped by their CCG or local health board in Wales. You can also see that, so this is the total number, and you can look at individual reasons for delayed discharge. So that's been a very brief overview of the demand and capacity dashboard. If you require any further information or you'd like a demonstration in person, please do feel free to get in touch via the details here. Thank you.